All right, let's go ahead and get started. Thank you all for being here today. My name is Becky Fine, and I'm the Associate Director of Programs at Active Minds. We're really excited to have this webinar today. We have a great lineup of speakers, and we were inspired to create a webinar that's geared towards campus professionals who are working on enhancing, advancing, or launching their mental health efforts on campus. And it was in response to the recent release of the study out of the RAND Corporation, which you're going to be hearing more about in a few minutes. The study demonstrated that activating and empowering students around mental health has incredibly promising results and can truly change the climate on campus. So the goal of today's webinar is to discuss that research and explore the implications of the findings while also demonstrating tangible and accessible programs that have been working on campuses across the country. So in the next hour, you're going to hear from some great speakers, and they are Lisa Sontag-Padilla, who is a behavioral and social scientist at the RAND Corporation and the lead researcher of this landmark study entitled Strengthening College Students' Mental Health Knowledge, Awareness, and Helping Behaviors. You'll hear from Melissa Selko, who is the Director of Wellness at Kent State University, who was the winner of the 2018 Active Minds Healthy Campus Award, a prestigious award that highlights campuses that are doing really well, really impressive and cutting-edge work around student mental health and championing students' voices. Then you're going to hear from Stephanie Preston and Sadaf Skandari, both from San Jose State University. Stephanie is a faculty member there and was the Active Minds Advisor of the Year in 2017. And they've been they'll be on the webinar discussing the journey of launching an Active Minds chapter at their campus several years ago. The chapter is still really strong and running today. And Sadaf was the student who led that effort at the time. So as you just heard, we'll start with the research. We'll hear from Lisa. Then we're going to hear from Melissa around centering student voices through policy. Then we'll hear from Stephanie and Sadaf discussing student-powered advocacy work on campus. And you'll have an opportunity to ask questions and have them answered at the end of the webinar. So quickly, for those who aren't yet aware of Active Minds and the work that we're doing, briefly, Active Minds is the nation's premier nonprofit organization that's supporting mental health awareness and education for students. We support students in their work on campus, and we work with faculty and staff in enhancing their mental health efforts on campus. So we're working to change the conversation around mental health. You can learn a lot more about us on our website, activeminds.org. I'll have that website up at the end as well. So when the RAND research was released back in early summer in 2018, we on staff came up with what we're calling a framework for mobilizing students around mental health. We created one that's geared towards faculty, staff, and administration, and we also created one that's geared towards students. And today we're going to focus on the one that's geared towards faculty, staff, and administration. We created a memorable acronym to try and keep it at the forefront of people's minds, with the premise that students know students best. And so I'll tell you what the acronym stands for here, and mention that this framework in detail is available for download on our website, and it'll be included in the follow-up email that goes out tomorrow. So SEATS, it stands for student informed, and this is through data collection and partnerships with students, really centering the voices of students on your campus in the decision-making processes. Equitable, by addressing gaps in opportunity among populations that are historically marginalized. actionable through the involvement of student leadership and partnership throughout the planning and implementation of programs. Transparent with the decisions, findings, processes, and more, ensuring involvement and proactive communication with students. And lastly, and extremely importantly, sustainable programming by institutionalizing the funding sources, people power, and creating an Active Mind student advocacy group on campus. So really quickly, I want to learn, before we get into the webinar, I want to find out from you all, who's in the room? So let me see if I can launch this poll really quickly, give you a minute to respond to the questions that you see here. All right, if you could go ahead and select your choices on that on the poll. Great, I'll give you about 30 more seconds to hear from everyone. Looks like we've got a good representation of time zones here. All right, excellent. Okay, so you can hopefully see the poll results here. It looks like we're spread throughout the country. And we've got a strong representation of campus professional staff. We've got some students in the room, and we've got some off-campus professionals. And then people are inspired to come to the webinar today because they're interested in learning more about launching a chapter, perhaps. Curious to hear more about the research in the field, ready to take student mobilization to the next level and trying to ramp up. Looks like we're hoping and pretty sure that this is going to answer some of your questions. So thank you for participating in the poll there. Really quickly, a couple housekeeping pieces for you to keep in mind. There's going to be an opportunity to ask questions at the end, but as they come up, you're welcome to use the Q&A function in Zoom, and I'll be seeing those. And at the end, I'll pass them along to the people that they're directed at. There's a chat box available for any issues that arise, and so that you know this webinar is being recorded and can be referred back to in the future. Okay, so without further ado, I want to pass the microphone over to Lisa Sontag Padilla to start us off. So I'll stop sharing my screen, open it up to her. Great, Lisa, there it is. Okay, if you could unmute yourself. I will. Oh.
There. Okay. Can you hear me?
Yes.
Great. Hi, everyone. Thank you for inviting me to participate in the webinar today. So Becky asked me to speak to the group today about the recent work we've published on Active Mind. So she mentioned this study that came out early summer, looked at the strengthening college students' mental health knowledge, awareness, and helping behaviors and the impact of Active Minds on those key pieces. So I want to start by giving you a little background information, so what got us to working with Active Minds and how we were thinking about the role of Active Minds in impacting students' mental health. So as you all probably know already, among U.S. college students, there's a substantial gap between mental health treatment needs, so those who have various forms of psychological distress, and their service use. Recent studies estimate that somewhere between 20 to 36% of college students deal with some form of psychological distress, whether it be depression, anxiety, feelings of hopelessness. Yet only about 1/3 of these students ever receive treatment, even when having services available on campus to them and insurance to cover costs for those services. So this unmet need for mental health care among college students really represents a significant public health issue. So without treatment, we know that students face a range of potentially serious and long-lasting consequences, such as dropping out, substance misuse, difficulties with social relationships, lower lifetime earning potential, all things that are of great concern to us as both practitioners, but also as academics and society at large. And so one of the things that we have seen through our work is that investment in prevention and early intervention programs not only improves student outcomes, but it also benefits society. So based on work that I've conducted with RAND and the California Mental Health Services Authority, or CalMESA in short, looking at investments in those PEI programs, we've seen that there was a 13% increase in the number of students who use mental health services on California's public higher education campuses between 2013 and 2014. And through some cost benefit analysis, we were also able to predict that this increase in treatment and an associated decrease in dropouts could yield a substantial benefit to society as well. So a return of $6.49 for every dollar invested by CalMESA in higher education programming around mental health support and treatment and so forth, and even higher in community colleges with a return of $11.39 for every dollar, which is really a lot of motivation for a legislature as well as fuel for those advocating for this kind of programming on campuses. We also had an opportunity to look at the role of campus climate on students' utilization of services in related work in the state of California. So we found on looking at, I think we had 31 campuses across the state of California in the 3 public higher education systems, and over 33,000 students responding to this survey. We saw that on campuses where they perceived the climate to be more supportive of mental health issues rather than stigmatizing, students were over 20% more likely to seek treatment and over 60% more likely to do so on campus as opposed to off. And so where are we going with this? Why does this matter? So this starts to get us to think about the role of peer-based organizations such as Active Minds. And so student peer organizations on college and university campuses are uniquely positioned to have direct effects on students' perceptions of mental health issues and associated stigma. And so in turn, they have the potential to increase the rates of students accessing mental health services by helping them see that, it's not something to be ashamed of, that there are available services for them, and even potentially to help connect them or provide a warm handoff for students. So there is this growing recognition of the importance of peers in mental health and suicide prevention programming on campuses. However, at the time that we were working with Active Minds, there was this paucity or lack of studies examining the impact of student peer organizations on factors that were likely to influence students' help-seeking behavior. And so herein comes the motivation for the work that we did with Active Minds. And so the goal of the Active Minds study was to examine the association between engagement with an organization, a peer-based organization like Active Minds, and changes in perceived knowledge around mental health issues, both things, and I'll get into the specifics of what we mean by that, but changes in perceived knowledge, attitudes, and helping behaviors related to mental health. And this was the largest, not only was it the largest study of the impact of Active Minds, it's also the largest longitudinal study where we follow students over time, looking at the effect of peer-based organization on these sorts of outcomes. So just to provide a little bit more context about the role of the California Mental Health Services Authority, or CalMESA. So California counties began working together in 2011 under CalMESA to develop and implement a series of statewide prevention and early intervention initiatives. There were three umbrellas of this: suicide prevention, stigma reduction, and then school mental health. And so the school mental health was aimed at improving student mental health in the three public higher education systems, as well as K through 12. And so this study, the Active Minds study, was part of this larger evaluation of activities under this initiative. And this funding through CalMESA involved support of expansion of activities and enhanced technical assistance for California-based Active Minds chapters. So just a little bit of information about how we went about conducting this study. So this was a multi-wave online survey of 12 California campuses with Active Minds chapters. We collected data from students in the beginning of the school year in 2016, January 2017, and the end of the academic year in May 2017. We recruited students with the help of the Active Minds chapters and the Active Minds fellows for varying levels of awareness and engagement with Active Minds. So we did not want simply students who were already involved with Active Minds, because we needed to understand and see the impact of becoming more involved and more aware of Active Minds over the time. So we tried to recruit students across this spectrum of interest and potential engagement with Active Minds. So as I mentioned, we worked very heavily with Active Minds student fellows to conduct in-person recruitment at event tables, Active Minds events, student union centers, and then also through a snowball recruitment effort through email correspondence, social media, and other similar approaches. So these are our four primary areas of interest. We asked questions around engagement, and we defined that by how familiar you were with Active Minds and how involved you were in terms of participation with Active Minds. We asked questions about knowledge and skills related to mental health. So for example, I can identify the places or people where I should refer peers with mental health needs or distress. We ask questions around stigma. I see people with mental illness as capable people, as an example. And then we ask questions around helping behaviors. So for those students who indicated that they had known or interacted with somebody who they felt had mental health or psychological distress, they indicated whether or not they provided emotional support, help getting them connected to professional help or other sorts of resources through the community or on campus. So we had nearly a little over 1,100 students, mostly female, which is pretty typical of this kind of research, but a very ethnically diverse sample. We had, starting at the first wave, so at the beginning of the academic year, we had about a even split of those students who were pretty much unfamiliar with Active Minds, had very little or no involvement. We had a group of about 30% who had moderate levels of familiarity and involvement, and then we had about 20% who were in that high familiarity involvement. And so we did see that both familiarity and involvement increased throughout the school year, which is what we want to see, not only for the efforts of Active Minds, but also for our ability to be able to tell whether there was an impact. Although not everybody changed at the same rate. So some were very involved by the end, and then some not so much, as an example. And so some of the key highlights from this study, one of the first big takeaways is that becoming more familiar with active minds, even just within one academic year, was associated with increased perceived knowledge and decreased stigma. And this was the case even among those students who were not directly involved with active minds. This was after controlling for a variety of things that we would think to be related to stigma and prior knowledge, so prior experience with people who had mental health needs, race, gender, age, the sort of the typical demographics that you think about. And so this was a very important finding for us and for Active Minds to know that simply being aware of active minds was impacting their levels of perceived knowledge and stigma. The other key finding that we found was that becoming more involved with active minds over the course of the academic year was related to positive changes in perceived knowledge of mental health issues, positive changes in the likelihood to intervene, but also actual helping behaviors across all three helping behaviors that we saw. So I want to point out that that's actually very challenging to see in such a short period of time. So I think this really speaks volumes to the potential impact that Active Minds has on those students who become more involved with the organization. So what are the implications of these findings? I think I want to know, and sort of tying back to the prior research that we did looking at the role of campus climate and getting students connected to mental health services on campus. So I think this speaks to the issue that improving campus clinical services is absolutely necessary, but it's not sufficient. Simply having services available is not nearly enough to get students there. And so we see that decreasing stigma, both at the individual level and potentially at the campus level, is critical so people can get the help that they need. With this in mind, these findings show us that student peer organizations like Active Minds play an important role in not only changing the campus culture with respect to mental health, but also supporting students by getting them to mental health services they need or providing the emotional support that they may be seeking as sort of a step before getting to services. And these are both important elements of addressing the unmet mental health needs of college students. So just as a close, I do want to give thanks and acknowledgement to Cal Mesa for providing support for this study, as well as to my RAND research team and the Active Minds team, Becky, Sarah Abelson, and the Student Project Fellows. So I know we'll have time for questions at the end, so I want to say thank you now, and then we'll circle back at the end for anybody who wants more information on this study.
Thank you so much, Lisa. Thanks for presenting your findings and your research. You can learn more about that study and read that if you go to rand.org and search for it in their function. You can also find it at activeminds.org/study, and I'll have that up at the end. So I want to pass it over to Melissa Selko to talk about their work at Kent State University. Sorry, Melissa. Let me, there you go. Now go for it.
One more time. So thanks, everyone. And thank you, Lisa, for all the work that the RAND Corporation is doing around understanding the value and the impact of student voices, and for Active Minds and all of their support, and Becky in particular. I wanted to kind of focus the work that we're doing here at Kent State and really kind of get to the core of how we approach the work that we're doing. So it's crucial to students when we kind of looked at the structure of our Healthy Campus initiative, students were first and foremost the ones that came to the table. We have 42,000 students on 8 regional campuses here in Northeastern Ohio, and then we have a couple thousand students internationally on 11 other locations. We have a large international student population as well. And so when we looked at the structure and the makeup of our student population, we really strive to recruit students from a variety of our academic environments. So not just, I mean, we have a College of Public Health and a College of Nursing, and of course, those are the folks who naturally gravitate to the work that we were doing around a healthy campus. But we really reached out to engineering and to liquid crystal and aviation and architecture. And when we did, we found that kind of outreach really enriched the conversations that we were having in the earliest days of the development of our program. And so students serve equally with faculty and staff on our executive team for what we call the Kent State of Wellness at our Healthy Campus 2020 project. And their voices have equal weight. And as a matter of fact, as the director, they're the ones who I spend the majority of my time with, even though I'm working really with an amazing staff of probably hundreds and hundreds of faculty and staff who are really dedicated to what we're doing. It's the students' voices that really drive the direction of the programming. They're really responsible for when we make changes to policy and procedure. Just an example of something that came up just recently, we had not had previously a fall break here at Kent State, and we found that there was a really big spike in mental health needs on campus during that kind of mid-October range. And so what we did was we added a 4-day break at the request of students. And so the undergraduate Senate as well as the graduate Senate were really responsible in helping us figure out the timing and helped pass resolutions that then we took up to leadership. And it was probably one of the smoothest, easiest things that we've passed policy-wise in a really long time. So their voices really count and are heard. We have our current president, Dr. Beverly Warren, is really focused on student voices. And so everything that we do, it's students first. That's actually the most important thing that we think about every single day. So for my work at Kent State, the Kent State of Wellness, we have a group of students that are called our Kent State of Wellness Student Ambassadors. Last year we had the first group, and we had 14 students really dedicated all the way from undergraduate up to graduate, and international students as well, looking for students who perhaps were underrepresented in different ways to make sure that their voices were strongly heard. And those, this year, I'm happy to say we have 20. And they really focus the work that we do on a programming level on a day-to-day basis. Many of the things that we do, and the project itself was actually started by students. It was their voices wanting to have a stronger, more robust involvement on a day-to-day basis. They did everything from developing the logo, which I want to show because I'm so proud of them, to actually doing our marketing. You see that? It's such a great logo. I just love all the things that they do. And then they take on individual projects. So each student that comes on, they come in with a particular passion, regardless of what their course of study is. And then they follow that through the course of the year. They get really involved with the faculty and staff who kind of spearhead those initiatives throughout the university. So they might be working with our university health center, our mental health clinicians. They might be working in our rec center and our wellness center. They might be working in the College of Public Health on some really robust projects that we're doing within the community. They choose that path, and then they inform me on a weekly basis, or sometimes just monthly, depending on the time of the year, on the projects that they're doing and where need is greatest. And then we're constantly brainstorming, how do we communicate that information out to students, making sure that they know about the resources that are already available. And then we have a second program that was also started by students. It's called the Seeds of Wellness. It's a mini grant program. We offer up to $1,000 to students on projects that allow them to take the initiative for an event or a resource on campus. So we've had some really interesting projects. We've done things like a heart climb. So that was the day before Valentine's Day. We had 250 students, faculty, and staff climb our 11 stories to in our library. There was a lot of education, and they did everything from designing the cups and the logo to manning the booths, making sure that we had the appropriate materials should anyone have any type of event while we were there. So we had first responders. Most of them were students. In every way, shape, or form, they control those projects. And then we ask them to look carefully at data. What are the pre and post experience of individuals participating? And then what did we learn, and how can we move forward, taking whatever it is that we learned about that event or that resource, and how do we integrate that into our community overall? Then we also have a summit that we are very fortunate that Allison Melman, the executive director and founder of Active Minds, will be speaking at our summit on April 3rd. And again, students take the charge here. They designed the programming, and they're very involved in the panel discussions. They're involved in the materials. They've decided that we're going to have music and art and this really robust kind of interactive media experience for the participants. They're going to outreach into the community. And if you hear me emphasizing them, it's because I'm a department of one. And so without their help, without their voices, without their direction, without their deep and passionate interest, we wouldn't be doing any of this. One of the other things that we did that we're going to be talking about at the summit, which will be focused on mental health this coming April, is a project that we did around students with neurodiversity. So the students themselves with neurodiversity issues, so students on the spectrum or students who may have experienced trauma, they decided that they wanted to have a resource and a room that they man themselves. And they told us what sorts of resources and programming they wanted to make available in that room, and how that room would be staffed and at what time. We were able to help leverage and find resources so that we were able to find a location, and we were able to find materials within the budget that we had available. But that project continues on. So we funded that early in last year, and I stopped by last week. And those students are really, really dedicated to being there for other students. So we have students who are seniors and even in graduate school who self-identify as being neurodiverse. And they're there to mentor and to help and assist those students who may still be finding their way through our very large university system. And it gives me hope. It gives me hope in the face of great, great challenges to resources. I mean, Lisa shared so much about issues around stigma and issues around access. And we find ourselves on the other end of that spectrum. Just last year, we added 8 additional clinicians. And at the beginning of this particular year, this particular academic year, within 3 weeks, we were already on a wait list. We happen to have the difficulty of being in a county which is relatively challenged economically and has limited resources around clinical services. And so we're constantly trying to find ways that we can support our students as we continue to staff up. And I tell people this all the time, and the students tell me this too. We can't hire our way out of our current mental health situation. We have to find ways to connect on an individual and group basis that continue to support the needs of our students. And the only way that we can do that is to really listen carefully about what they themselves need and what they want, and what their own experience is in supporting students on a day-to-day basis. I always refer to them as the boots on the ground, right? If a student is having a crisis, it's most likely another student that's within the closest proximity. We need to train them. So we bring those robust tools that they're looking for. So we have mental health first aid, and we have cognito, and we have resiliency training, and we have group therapy sessions. And the other thing that I want to talk about, and this is something that was a personal passion of mine before I came to Kent State, and I found a lot of support and a lot of interest from our students, was bringing meditation and mindfulness to campus. And so at the beginning of this academic year, we launched a program called Meditation Across Campus. It's an opportunity for students, faculty, and staff to drop in for a 30-minute facilitated meditation experience. It's all grounded in the work of John Kabat-Zinn out of the University of Massachusetts and the MBSR model, so mindfulness-based stress reduction. Students really appreciate this. It's grounded in science. It's grounded in the physical experience of the body and breath. And I have to tell you, it's been the most amazing experience. We have 9 sessions running right now a week. They're all, and we call it Meditation Across Campus because it's in locations where students have told us that fit within their schedule. So our sessions between 11 and noon and then at 4 all seem to be the most popular. Right now, I'm working with students and faculty, staff, and some community members so that we can have additional facilitators. And there are a lot of students who are really passionate around this. So we're trying to find ways to engage them and give them an opportunity to do additional training so they themselves can enrich their own personal meditation experience and then share that through these facilitated sessions. We also are bringing Karoo Mindfulness, which is the model developed out of Duke University, another fellow winner for 2018, and the Active Minds Healthy Campus. And their model is strongly based in the MBSR, and students love it. I'm halfway through our first session and learning a lot from the experience of working with them. And my hope when we bring the Karoo training or teacher training here in August is to train as many students as we can to be Karoo trainers themselves. And again, this is a way for them to work with other students and to feel empowered. Sometimes we teach the thing we most need to know ourselves. And I think that's a human experience. I know it's mine. That's why I love to teach meditation and mindfulness, because it's what I need the most. And their enthusiasm and their passion and all of the things that they bring every single day. They come up with new ideas about, I mean, we already have 350 or 370 some student organizations on the main campus here, or the primary campus in Kent, where we have 28,000 students. And every year they ask for more and they come up with their own ideas. And then they, of course, man and bring about life around the organizations such as Active Minds. So it's really crucial and it's fulfilling in ways that I had no idea when I first came to academia a year and a half ago from the private sector, the richness of this experience and the learning in really unique ways. So their voices are central to everything that we do, and I'm grateful for that. And I'm grateful for the opportunity to share their experiences and some of their work with all of you and with this great team. So I'll wait for questions at the end. Thanks, Becky.
Thank you so much, Melissa. I really appreciate hearing about your work at Kent State. And I'm going to share in the chat box right now. If you're interested in reading more about Melissa's work and the work of the other Healthy Campus Award winners, you can find that at activeminds.org/Healthy Campus Award. Each year when we release or when we give these awards out, we compile a report with the key findings so that other campuses can access it and hear about what these folks are doing. A reminder that if you have questions for the panelists, you can start submitting them through the Q&A function, and at the end, I'll read them out to the panelists. So with that, I want to pass it over to Stephanie and Sadaf from San Jose State University, and preface it by saying that San Jose State was invited to be part of this webinar because theirs is a really interesting and unique story of one student who is very passionate about changing the conversation on her campus, and a very supportive advisor. So one student and one staff person, and this was 5 years ago now, and 6 years ago, and the campus is, or the chapter is thriving, and one of our really, really strong chapters in the network. So with that, I'm going to unmute Stephanie and Sadaf here. All right, take it away.
All right. Hi, everybody. I'm Stephanie Preston at San Jose State. As Becky said, I'm a counselor also at the Counseling and Psychological Services. And I actually came into the role as faculty advisor Second to my colleague, Dr. Colleen Johnson, who started the chapter with Sadaf. So I'm hoping Sadaf will speak to the very, very beginnings of the chapter here at San Jose State, and I'll kind of jump in with when I came in the, I think, spring of 2016. Sadaf, are you there? You might be muted.
Hi, can everyone hear me now?
Yeah.
Okay, awesome. Hi, everyone. Thank you so much for having me. And thank you so much, Becky. I do want to highlight something important that you said, that it could just take one or two people to start such a big and important conversation about mental health. And that's sometimes all you need to make a large impact. So I'll talk a little bit about how we started at San Jose State. And it seems like so long ago. I think it was 2012. I was actually at a mental health first aid training, and that's when I met Colleen Johnson. She's a faculty at San Jose State too, and one of the trainers. And I thought the training was so awesome and had so much helpful information on how to intervene and support someone who's struggling with mental health. And after the training was over, I went up to Colleen and I said, you know, I really love this, but how can we make this more widespread? I mean, the trainings can only hold maybe 10 up to 20 people. And at the time, I was noticing that we didn't really have a student-led mental health organization or group. And that was one of my biggest interests, to get that going. And she was the one that introduced me to Active Minds. At the time, I didn't know anything about it. And she said that she was involved in Active Minds at her college campus, and they got a chapter starting, and she told me to look it up. And so I did. I did my research and I met up with her again. I said, I think it's an awesome idea and it could really incorporate um, so many student voices and really change the culture and atmosphere at San Jose State and make the stigma so much less and the conversation so much more normal as well. So it just started off as me and Colleen, and slowly but surely we are where we are today. And at the time, I think it like any other chapter, it's so hard to start off with just a couple of people and to grow people's interests and to really get the name out there. I want to talk a little bit more about Stephanie before she speaks of herself, but Stephanie was really key in helping us grow in small and big ways. As soon as she joined us, I think a year after we got our chapter up and running, the key way she was supportive in helping us is that she was just such an amazing advocate for us. She helped the name of Active Minds become more known at our campus. And given that she was working at our counseling center, she really wanted to include our voices. She invited us even to the meetings that the other faculty, staff, and counselors were a part of on a weekly basis. She was passionate about student-led organizations and is a part of several other ones, which she can speak more of too. And even though Stephanie was more on the outside, she did make a big impact on the inside. Even if she wasn't at our meetings or events, she really did whatever she could to help us get those activities on campus or groups or speaker events. When Maggie came to our campus, she wrote letters of support for us when we had Send Silence packing for the first time at San Jose State. Um, she made sure we had rooms, tables, whatever it was that we needed. She had an open door to us, and it was so, so helpful. It's hard to name everything that she ever did for us, and I'm sure she's continued to do more. I have left San Jose State. It's been 2 years since I've been there, so I know she continues to be an awesome advisor and um, just really caring about students, and that's so awesome. And as much as she was an advocate for us, we were also an advocate for the counseling center. Like, constantly we're telling people, And it's surprising to know how many students didn't know we had free counseling at school and the number of sessions and how to go to the counseling center. So we advocated for them too. And I think that's how we became a really good and strong team and got our name more out there. And people really enjoyed coming to us, and it was something easier for them to do. And I think just the more friendly faces, especially Stephanie's, the easier it is for students to reach out. It's, as people do know, it's hard for people to reach out. We have to be the ones that reach in. So I really appreciate Stephanie and all the other students too. I think as much as students working together can make a big impact, adding staff too is very crucial and helpful because they have a lot of knowledge and experience too. We all have to work together. And she has great connections with the higher up people on campus. And sometimes you need those people to make like really big decisions, like hosting things such as Sun Silence packing, or even bringing pets and dogs. I didn't know how many policies there were, but things like that. So you need that sort of higher up support on things like that. And I know we have a short time, so I want to let Stephanie talk too.
Thanks,
I
Sadaf.
look forward to the questions if there are any.
Yeah, thank you, Sadaf. Again, I blush when she says these things about me because I feel like I am really behind the scenes. My role as advisor is to support the students. And I went to the Active Minds conference a couple years ago and went to the advisor session, and I was really impressed at how much a lot of other advisors do to run these chapters. And unfortunately, that's not the role that I can have considering my full-time job as a counselor in the counseling center. That's very popular, in part thank you to Active Minds. So I do find myself behind the scenes a lot of times, and the students really run this show. Sadaf and she had I think vice presidents and treasurers and a couple people when I came in that really came up with the ideas for the events, found money, I think, in their own pockets most of the time, and held the meetings and did all of the work. And as she said, I have some connections on campus and I can sign off on things and do the policies, but they really are, I think, as Melissa said, the boots on the ground and the people putting in the hard work every day, every week. So as I said, I came to the chapter in the spring of 2016. I took over for Dr. Johnson, who started it. As I think Sadaf's mentioned, she'd been in an Active Minds chapter, I think, in her undergrad. In my graduate school, I ran a chapter of Psychologists for Social Responsibility. So not the same sort of thing, but running an organization was something I had loved doing, and I wanted to be a part of this. Also, again, has been said, us here at the counseling center, we can't do all the mental health work for a campus. San Jose State's about 35,000 students, and we have, I don't know, maybe 15 counselors, full-time-ish. So I also love doing prevention and outreach work in general. Sadaf mentioned I do a couple other things. I have a LGBTQ student mentoring program that I facilitate. And I think that those prevention, intervention, peer-to-peer mentoring, and so on programs are really needed and frankly, a really fun part of my job too, outside of the therapy room. So I was thrilled to take over as the advisor. And again, I think my role has been to help the students figure out some of the policies and procedures, to get in touch with some of the folks in our student involvement is the part of the organization on campus that sort of runs the student organizations and clubs. So making sure we're all attending the right trainings, making sure that I know what the different policies that are that we're holding the students in the clubs and organizations to. Like Sadaf said, getting permission to have pets on campus. We did pet therapy, very popular event, a couple years in a row. So yeah, doing the logistics. And then the next thing that I think was really helpful for us was a colleague of mine here sent a a call for a mini grant, the Each Mind Matters California Mental Health mini grant set off, right? And it was $500, 100. I
Yes.
can't remember. It was not very much, but it was, I think, the reason we opened a bank account. So that was great, and that afforded some money, which I think got the ball rolling and got, you know, some swag and shirts and tablecloths for tabling and things like that. And then the RAND study was huge, and getting in touch with Becky. Sadaf and another student were trained to help with the RAND study, the research. They became fellows, and maybe Sadaf, you want to talk about that training, but I think it was, it seemed like it was really instrumental in helping you recruit new students into the organization. I think that year, that maybe fall, was when the organization blossomed from a handful of Active Minds active members to 30 or so, maybe. Does that sound right, Sadaf?
Yeah, and I mean, our emailing list grew more and more every year. I don't know what it is right now, but I remember when I left, it was like 300 students. And I mean, it was nice to know that people just knew what Active Minds was, even if they weren't on our mailing list. They were like, "Oh yeah, Active Minds, I've heard about that."
Right. I just talked to a student today about something totally unrelated, and I said, "Oh, you know, you might want to look up this group called Active Minds." And he said, "Oh yeah, I've heard of them." And I'm, "Oh, okay, cool." So yeah, I don't know what the mailing list is now, but the meetings are solidly 30 students every couple of weeks. They're putting on events every month at least. We are hoping to do Send Silence Packing again in the spring. And yeah, I think it's just, I think the being a part of the RAND study and having that support from the national organization, from Becky and others, really helped blossom the chapter and get it going. And, you know, it was just one of those cascading snowball effects where the more money we had, the more events they put on, the more students came, the more events we could put on, and so on and so forth. So it's been a lot of fun for me to be involved. Thanks for having us.
Great. Well, thank you all for speaking. I want to open the opportunity for folks to ask questions if you've got them. But as people are thinking, I've got a question or two for our panelists. First, to Stephanie and Sadaf, I'm curious, what's one piece of advice you'd offer to somebody who's perhaps brand new to Active Minds, gearing up for a student-powered advocacy effort on campus? What's kind of a nutshell piece of advice you'd offer?
There's so many. I would say to be patient. I had a lot of anxiety in the beginning and so many things I wanted to do, so many plans, ideas, etc. But just being patient and trusting that things will follow through and blossom, as Stephanie mentioned. Because we are very excited and passionate people, and we want to see things happening right away. So that's something I had to learn, and I realized.
Slow and steady. Yeah, absolutely.
Yeah, I would echo that and say persevere. You know, you might have to ask a lot of times to get the answer that you want, but keep pushing and keep asking and keep networking. And, you know, if you contact one person and they can't do it for you, then ask who you should get in contact with next.
Great. Yeah. Melissa, I want to send that question to you also. And here, I'll unmute you here. What would be your piece of advice for someone who's interested in starting the work of really institutionalizing student voices the way Kent State University has?
Wow, there's so many different pathways to do that, and you have to do them all. You know, that persistence and perseverance. And, you know, we talk about here on our campus, the noise, and you all know what that means, right? There's so much going on for students. There's so many different activities. There's so much coming at them. Figuring out how to cut through that and not contribute to more noise is an ongoing challenge. But I find the best way to do that is through this kind of grassroots effort. So when we first started and wanted to engage students from a lot of the different colleges, the way that we did it is we went to talk to the dean, and we talked to the advisor of every college, and we told them what we were looking for. And then we met with faculty, we met with staff. we just kept talking about that we wanted more voices from a more diverse areas of the university. And it took an entire year. And during that entire year, I got to meet just about everybody in our university, which was kind of an awesome experience. But then once we had the students in, then they brought friends, right? And that's what you want. You want the students to come and you want them to share their stories with their, they're an RA, or their roommates, the other groups that they're in, sitting in a classroom talking about it, and then bring them to these events and opportunities and meetings. That's the richest way to bring people in, because they're interested and it's something that they feel passionate about. And then you've got kind of that lovely alchemy that gives birth to everything else.
Yeah, absolutely. Thank you. And Lisa, for you, I'm wondering kind of a two-part question. I'm curious, one, if people wanted to learn more about kind of the breadth of student mental health research that you've been working on over the past several years, where can they find that? And curious to hear from you, what in your mind are some of the key learnings for campus professionals? What would be your piece of advice for them?
Sure. So I think the easier answer is the first question you asked. So if you're interested in finding out more about not only the work that I've done, but the whole team at RAND related to CalMESA, the easiest way is to go to rand.org, RAND.org, and put in the acronym CalMESA, CALMHSA, which are also my slides, and in the search engine, and you'll see there's a thing that pops up where there's a link for CalMESA publications. So you can see not only everything that's happened under the student mental health arm of things, but also suicide prevention and the stigma reduction. There's a whole suite of reports and publications there. So as far as the piece of advice I would give to faculty or professionals working with students, or even students working with students, I think that stay motivated by the findings that we've been able to illuminate. That simply, I think the work that you've been doing to create a presence on campus, whether it's through Active Minds or other sorts of efforts, shows that it does help progress and move things forward towards a more tolerant, supportive environment that we know is also then related, and not for the same study, but piecing all these things together, we know that campus climate is associated with greater service utilization, which we know will get students to a better place, but may also serve in a preventive sort of way. So I think continuing efforts to sort of build that awareness of Active Minds, awareness of, just better understanding of mental health needs in general, and reducing stigma around that, I think sort of keep going with that effort. We don't know quite enough about the specifics of what Active Minds is doing, or organizations like Active Minds. We don't, there's a lot of things that you all do. As Melissa has stated, and Stephanie has stated, and Sadaf has stated, there's a whole array of activities. So we don't yet know which ones seem to be most impactful. So I think there's some next steps. So certainly if there's opportunities to either partner with those who are trying to do these sorts of studies, especially on a large scale, that I and the RAND team, and hopefully others, have altruistic motives. We want to help understand sort of what elements are really helping the students, to then sort of feed that information back to you all so that you can better refine your efforts that you're doing, and be able to have the most impact with often very small budgets and very small staff. You all do a whole lot with very little, and it's very impressive.
Awesome. Well, thank you all. I want to thank everybody for being part of this webinar, and especially to our panelists who are doing incredible work and sharing that with the field. I want to leave up on the screen here some additional resources. You've got some links there that can get to Lisa's work and to Melissa's work through the Healthy Campus Award, and the frameworks that we referred to, the seats, and how we've come up with or the way we framed these findings. And you're always welcome to reach out to me if you want to get in touch with one of our panelists or have questions for me or about Active Minds. So thank you all for being here, and have a wonderful rest of your day.
Thank you.